Hi, my name is Sarah Tinsley, and this is my pre-op teaching video for a patient undergoing a laparoscopic cholecystectomy. Hello, Mr. Smith. My name is Sarah, and I'm a student nurse with Centera College of Health Sciences. I'm here to go over your preoperative checklist and confirm some information before your procedure, okay? Okay, great. Can you verify your name and date of birth for me? All right, John Smith, March 23rd, 1955. So that would put you at 66 years old, correct? Okay, great. And what are your allergies? Penicillin? Okay, and what are your reaction to that? All right, moderate hives. Okay, great. Any other allergies you could think of? Okay, good. So your medications here include lisinopril. You're taking 10 milligrams daily. Ibuprofen 800 milligrams 3 times daily as needed for pain. You're taking a multivitamin once daily from Centrum. Okay, and sol palmetto 180 milligrams 2 capsules daily. Is there anything else we should know of? Any other medications or herbal remedies? No? All right. So I see that you brought the list of medications with you. That's great. We'll provide this to the provider as well as the anesthesiologist, okay? All right. So just to let you know, you may be asked to stop taking the sol palmetto because it has anti-coagulation properties, and this could put you at risk for bleeding during your procedure. Also, your lisinopril, that could put you at risk for your procedure for hypotension, so you may be asked to stop taking that as well. But again, the provider and the anesthesiologist will clarify those for you, okay? Okay, great. So going over your medical history, I see you have hypertension, myopia, and arthritis. Is there anything else as far as medical that we need to be aware of? No? Okay. So your past surgical procedures include a laparoscopic appendectomy done in 2012, a knee arthroscopy in 1997, and an excision of a benign mole in 2000. Did you have any other surgical procedures done in the past that we should know about? Okay, a colonoscopy in 2018? Okay, I will make sure that that is in your chart. It looks like you're scheduled to have a laparoscopic cholecystectomy under general anesthesia on August 24th, and that's going to be done at 10 a.m. with Dr. Bruner at the Pulaski Memorial Hospital. Do you understand why you're having this procedure done? Okay, and just to clarify, so it looks like you came in with abdominal pain, heartburn, nausea, and vomiting. Your CT revealed that you had a distended gallbladder and you were diagnosed with biliary colic and cholelithiasis. So that is a presence of gallstones within your gallbladder. And I understand that you have concerns with the nausea and vomiting post-op. So I want you to know that these symptoms are normal to experience when associated with anesthesia. But I do see that your father had a history after a procedure for prolonged nausea and vomiting, so I can understand your concern. I'm going to go ahead and let the anesthesiologist and the provider know of this concern. And the anesthesiologist is going to let you know. They'll go over what to expect, if these side effects could be alleviated in any way, and when they may become a problem, okay? But if that is your concern, the provider may be able to give you an antiemetic, and that will reduce or prevent symptoms of nausea and vomiting post-op, okay? All right, great. Reviewing your labs and pre-op tests, Dr. Ronald Strauss reviewed your most recent EKG and lab studies results, and it looked like your EKG showed a normal sinus rhythm, so that's good. And he also said that you are a low-risk patient for cardiac complications, so that is also good. That's why he recommended that you go ahead and get this procedure. Your CT done on July 23rd showed that your gallbladder was mildly dilated and cholelithiasis was present. They did notice a simple appearing cyst on your left kidney, and it was noted that it was unchanged since your last CT scan back in 2012, so that is a good thing. Does all this information sound correct to you? Okay, good. Your HIDA scan is used to assess your gallbladder functions, and it looks like your ejection fraction was at a 19%. That is fairly low given that the normal EF is 35% or greater. But again, this is suspected to be due to your presence of gallstones. So reviewing your labs that were completed on August 10th, Your blood work and blood chemistry labs all look normal, but your blood glucose was slightly elevated. It looks like it was at a 147 and a normal range is at a 140. I see that you are big on diet, exercise, and lifestyle to reduce your hypertension, and those things are also going to help with your elevated blood glucose. So just want you to know that even though it's elevated, it's not at a alarming rate, but definitely keep doing what you're doing, and we shouldn't expect any complications post-op or during your procedure. So you're going to need to arrive 2 hours before your scheduled procedure, so that would put you here at 8 a.m. Again, you'll be under general anesthesia for an inpatient procedure. Please remember not to eat or drink anything after midnight. Eating and drinking is going to put you at increased risk for aspiration, and you may also experience nausea and vomiting, which you don't want to feel anyway, so definitely no food or drink past midnight prior to your procedure, okay? And it looks like while you're on general anesthesia, you're going to be given medications to put you to sleep, but also to not feel any pain. So you're going to be intubated and put on a ventilator to help you breathe. And you can expect to be given a Foley catheter to assist you in emptying your bladder while you are put to sleep. This will be removed as soon as you wake up, and that will help prevent any hospital-acquired infections and things like that, okay? So I do need to examine your mouth real quick prior to this procedure, so if you can open for me. Okay, thank you. I don't see any signs of missing teeth, cavities, dentures, things like that. And there is a visualization of your soft palate and uvula, which is great. And it states on your chart that your Mullen-Potty score is of class 2. That means that there should be no anticipated difficulty with intubating you during surgery. Do you have any questions so far? Okay, good. Is there going to be anyone here for your procedure? Your wife? Okay, and what's her name? Kay Smith. Okay, so I'm going to go ahead and get all her information. That way the circulating nurse could contact her and provide her with updates during your procedure, okay? All right, and do you wear any jewelry, glasses, contacts, things like that? Glasses and contacts? Okay, and just to let you know that those things need to be gathered and collected. We can keep them safe for you, or you could choose to leave them with your wife or leave them at home. And this is just... we can't allow those things in the operating room to keep a sterile environment and to make sure that those items don't interfere with your procedure or the surrounding equipment and things like that, okay? Okay, great. And it looks like here, let's see, do you have any cultural or religious considerations that we need to be aware of? No? Okay, good. And it looks like you have no contact precautions in your chart. And there's no potential of you being pregnant given that you're a male. Is this correct? Okay, good. So following your surgery, you're going to remain in the hospital to monitor for any complications. We want to make sure that you're on the right medications and monitoring your surgical site for any signs of infection and things like that. We also want to give you some time to rest and heal post-op. You're going to be given sequential compression devices. Those are going to be wrapped around your legs. They'll provide pressure to ensure that we reduce the risk for deep vein thrombosis, which is blood clots, okay? So it's important that as soon as you feel well, you get up, you walk around, and that's to help get your blood circulating, okay? We're also going to monitor the IV site for signs of infection. That would be redness, swelling, itching, pain, things like that. So let us know as soon as you experience any discomfort, pain, anything with your IV site, okay? You can expect some pain medication after surgery to help you feel comfortable. You may feel some tenderness or soreness within your abdominal region. This can include, these medications could be anything from opioids to ibuprofen. The provider will make those decisions and discuss those with you. If you don't want medications, there are other ways to alleviate pain, such as hot or cold therapy, things like that. So you just let us know your preferences and we'll go ahead and provide those for you, okay? Do you have any questions for me? No. Good. So the doctor's going to come by and have you go over the consent form. This includes any risks associated with the surgery, benefits, alternatives to surgery if there are any, and you're going to sign the consent form stating that you understand everything that was stated and why you're getting the procedure, and I will be a witness to you signing that form, okay? And again, this pretty much concludes our pre-op interview. So do you have any last minute questions or concerns that you can think of? No? Okay, good. So we will see you on August 24th at 8 a.m. Okay, great. Thank you, Mr. Smith. You have a good day.